It's that time of year when doctors start encouraging you to get that flu shot. Last year, you may remember all that confusion surrounding the H1N1 vaccine as well as the shortages. Well, here to talk to us about this year's flu season is Dr. Trini Mathew, an infectious disease doctor at the UConn Health Center. Good morning, doctor.
Good morning.
How are you doing?
I'm doing very well, thank you.
Fabulous. Let's start with the H1N1 vaccine. Is there going to be a separate vaccine for that again this year?
This year, the H1N1 strain that we had from last year is combined in the trivalent vaccine that's available. So this year, we need to just get one flu shot, and it would cover the H1N1 from last year also.
So that's good news. I think that's definitely going to help with some of the confusion. Now, is H1N1 as big a concern this year as it was last year?
Currently, we're early in the flu season, so it's hard to predict what might come out to be, but it could be circulating in low levels, so it's still advisable to go ahead and get the flu shot this year.
Okay. Let's talk about the recommended age for the universal vaccination that you're talking about.
Yes, currently Centers for Disease Control and Prevention has changed their recommendations now saying that this is a universal, recommending everyone to get immunized against influenza age 6 months and above. So we don't have a specific criteria, but of course the people who are at higher risk for coming down with complications after coming down with the flu, it's still recommended for them to get immunized. But however, we are also recommending Centers for Disease Control is recommending everyone age 6 months and above to go ahead and get immunized.
Okay, am I correct in saying the flu shot is being called the universal vaccine this year? Is that right?
It is a universal, it's recommended universally.
Okay.
In other words, 6 months and above, you want to go ahead and talk to your physician about getting the flu shot.
Great, thank you. Thank you for clearing that up. Now, there's also a new requirement in the state for kids in daycare that some of our viewers may not know about. So talk to us about that.
The state of Connecticut is requiring for children 6 months and above going into daycare for the parents to go ahead and speak to the pediatricians about getting the flu shot. And there are certain requirements whether you need to get the first dose or you want to get 2 doses in. So those are some of the nuances they need to speak with their pediatricians. Now,
it's easy for parents to tell their kids they have to get the flu shot to make them get the flu shot. But what do you tell the parents or the patients who are maybe on the fence about getting a shot themselves?
The first thing to remember about protecting yourself against flu is to take a flu shot. And the flu shot will give you protection and prevent you from coming down with severe illness in case you do still come down with the flu. And please keep in mind that the flu shot not necessarily gives you the flu. It does not really give you the flu. It protects you against the flu. But it takes up to 2 weeks for your immune system to make the antibody response so that you get the appropriate protection. So I would still recommend everyone think about getting the flu shot this year.
Okay, let's briefly run through some of the symptoms of the flu. Again, it's different than a cold. So some things that maybe you can look out for is fever, cough, sore throat, runny or stuffy noses, right? Body aches, and what are some of the other symptoms?
Correct, and these are the main symptoms. However, people do need to keep in mind that they necessarily do not always have fever with the flu, and people may be shedding the flu virus even the first day prior to coming down with these symptoms, and all the more reason to protect yourself and people around you by getting the flu shot so that you're protected and you do not come down with these symptoms.
Wonderful. The doctor's advice, get your flu shot. Dr. Mathew, thank you so much for being with us here this morning.
Thank you very much for having me here.